The spinal cord is a complex and fascinating part of the nervous system, but it's also very difficult to study using non-invasive imaging, especially when it comes to imaging blood flow and vascular function. Now, Northwestern Medicine investigators have developed a new functional MRI or fMRI based approach to more accurately assess blood flow in the spinal cord, with potential to better inform treatment for neurological diseases and injuries. This discovery is detailed in a recent study published in Scientific Reports. We're joined today by its senior author, Molly Bright, to talk about the findings and how this approach may one day help clinicians detect early disease, monitor recovery, and guide treatment decisions in people with spinal cord injuries or diseases. Molly is an assistant professor in the Department of Physical Therapy and Human Movement Sciences at Feinberg and of Biomedical Engineering in the McCormick School of Engineering. Welcome to the show, Molly.
Thanks for having me.
Tell me a little bit about your lab here at Northwestern and what drew you to doing this kind of translational research that can impact human health.
Sure. My background is in engineering and physics, and so most of my career before coming to Northwestern, I have developed methods. And I've enjoyed that greatly, but with the move to Northwestern, I found myself surrounded by people who had good uses for these new tools that we were coming up with. In particular, I found myself in the Department of Physical Therapy and Human Movement Sciences. And when you're studying movement, you really want to capture not just what the surface of the brain is doing, but actually how that information from the brain gets connected to the rest of the body. And to do that, you need slightly different imaging tools. And I thought that was a very exciting challenge and a worthy target, something to go after.
I love that. Tell me a little more about your lab in general. What type of research is your team taking on?
Yeah, so we have several different strategies for making functional MRI, hopefully a bit more useful. It is a very promising technique. It has a lot of potential because of what it's able to do compared to any other medical imaging technique. It can really see further into deeper structures. It can capture neural activity, vascular function. So there's a group of students in my lab, and they're all engineering students. Every single one of them is trying to figure out a new imaging method, and it's all within MRI or functional MRI, but they're all trying to push this method in a different way, and with that, they have a clinical target in mind. So some of my students are trying to really understand motor control. Some of my students are really trying to understand how we react to different breathing environments. Some of my students are trying to get very precise information in stroke subjects, and then some of my students are trying to understand the spinal cord. And each of these projects means you need to make the imaging a little bit different in order to be successful.
And what about the tools at your disposal here at Northwestern, the technology that you have? How does that enable you to do this type of research?
Yeah, we have a fabulous imaging center here. It's the Center for Translational Imaging, and it's divided into more of the cardiac and body imaging and then the neuroimaging side. And as part of the neuroimaging CTI community, we've got two top-end MRI scanners that are dedicated for research. So when I came to Northwestern, I started working very closely with the director of that center, Todd Parrish, and he had already been developing some of the spinal cord imaging methods, and I was able to really learn from him and build off of his expertise and kind of push those methods myself. So we've got these great scanners and great people who are helping us make the most of them. In many ways, I'm trying to use functional MRI to understand the brain's plumbing, how that blood supply that's actually delivering the nutrients you need, removing the waste, how that vascular system is supporting the central nervous system. I think in many different pathologies, it's actually a vascular problem that causes a whole bunch of neural consequences, or it's circular. And so really being able to capture what both systems are doing is going to be important. And functional MRI is pretty great because it can really capture both sides of that coin.
A lot of the research taking place in your lab is on healthy people. A lot of this fMRI research. Why are you looking specifically at healthy people, even though you're studying things like spinal cord injuries and stroke?
I think our lab with this most recent work, we're really the first people to see the things that we're seeing at all inside of people who are alive. And it's all very non-invasive. So we haven't interrupted the healthy functioning of the spinal cord. So these measurements that we're making, we're learning quite a bit just about what happens in a healthy spine. How is the spinal cord supported by the vasculature? And that's something where we're learning a lot just by looking in healthy adults.
I want to talk more about that because the spinal cord has been very difficult to image in the past compared to the brain. And as you said, you're charting unknown territory here. Tell me about that first. Why is the spinal cord so much more difficult to image than the brain?
Yeah. So the brain, it's not that big, but it's pretty big by our standards. It's about a grapefruit, and our imaging resolution is, let's say, about 2 millimeters. And this grapefruit brain, it moves a little bit, but we're able to do a lot to correct for that. And we've gotten very good at it. And methods over the last 20, 30 years have all focused on getting better and better at imaging the brain. As soon as you go a little bit down, as soon as you go into the brainstem or into the spinal cord, everything gets harder because, first of all, now we're talking about a very, very small anatomy, and our resolution is now just at the border of being sufficient. It's also surrounded by cerebral spinal fluid, so you've got this liquid that is flowing and pulsing and creating a lot of artifacts in the data. The person you're imaging is breathing, and so you've got movement of their chest is creating a lot of artifacts in the data, and the lungs, as they fill with air, that creates additional artifacts that make it look like the spinal cord is wiggling. If you have a living, breathing human being in the scanner, which hopefully you do, all of that is pretty disastrous for data quality. So you have to just, on many fronts, try to tackle each one of those problems in order to really see the cord and make sense of it.
So, in this recent paper in Scientific Reports, you introduce a new way to map spinal cord vascular reactivity using the fMRI. Take me back to the start of this study. What question were you trying to answer?
I can take you back all the way to the start of my career. The very first measurement I ever made was vascular reactivity. It was in the brain. Functional MRI, I think almost anybody who knows about it peripherally thinks of it as a tool to study neural activity. You see it in popular TV shows. You can make a map of where in the brain is active when people see these pictures or do this task. But functional MRI does not measure neural activity. It actually measures vascular changes. It measures changes in blood flow and blood oxygenation. So it is a vascular imaging method just being used as an indirect measure for brain activity. But in my doctorate, way back when now, I started using it as a vascular tool and trying to understand how vessels can respond. You need your vessels to be able to dilate and increase blood flow at times in order to support the healthy function of the tissue. And so this measure of vascular reactivity is really taken off in the brain because it's a great way to say how healthy is the blood supply, how resilient is it? If the vessels can't respond, maybe the tissue might be at risk. We've gotten this measurement pretty well sorted in the brain. It's starting to enter clinical practice a little bit, but in terms of being able to measure other parts of the body where it's equally important that you have that very responsive blood flow, that hadn't been done. So I found myself at Northwestern where spinal cord imaging was becoming possible. I had all of these techniques in my back pocket of how we can use functional MRI to capture these vascular changes. And then with some very clever work from my graduate student, we put it together and just thought this is a very important unknown thing of how is that blood supply actually regulated, because it is likely to go wrong in several different patient groups, and that would be a helpful measurement.
You're talking about these kind of clever ways that you designed it. So in this study, instead of a more invasive approach like injections or contrast dyes, your team used this breath holding task on the subjects to trigger blood vessel dilation. Tell me about this. What did you have these folks do when they were inside the scanner?
Everybody listening could practice. You breathe in, you breathe out at a nice paced rate, and then at some point you're asked to just hold your breath about 15 seconds, maybe 18 seconds, and then breathe normally. And just that short of a breath hold increases how much carbon dioxide is in your blood, and that then causes vasodilation. Your blood vessels everywhere dilate, and that dilation, the increase in blood flow that it causes, that's what we can pick up with the functional MRI.
Had this been used before in the literature, this technique?
In the brain, for sure. I think one or two other groups used it to try to validate other models, but we are the first to try to really map this and capitalize on it to get sort of a characterization of how are the blood vessels in the spinal cord responding.
When you asked people to hold their breath, you expected to see blood flow increase across the spinal cord. But what you found was definitely more nuanced.
Yes, and we didn't know to look for this going in, so this is all post hoc, ooh, interesting kind of stuff. But we saw one thing we can measure is not just how much the blood vessels dilate, but also when they dilate. So we saw that part of the cord responded a bit sooner and part of the cord responded a bit later. And this sort of aligns with what we know from hand-drawn figures in old textbooks of the vascular supply, that you have two different, maybe arterial supply regions, these vascular territories, and that maybe these different regions respond at a different time, and our method is sensitive to that kind of difference. The idea would be not only can we say how healthy are these vessels, how much can they respond, but the different parts of your sort of vasculature, are they supporting the regions they should, or is something atypical happening in a given person?
So, why is this kind of information important or matter so much in spinal cord disease or injury?
I think that probably this is going to be important in a few different fronts, some of which are maybe more feasible targets than others. The target that I'm most interested in, the application that I'm most interested in, is going to be people with non-traumatic spinal cord injury. These individuals, usually something age-related, degeneration of their spinal discs, but something is causing compression of the spinal cord. And it's to the point where if you get an MRI scan and you're over the age of 50 or 60, many of us will have compression of our spinal cord. And many of us are fine, but some of us are not. Some of us start to have this progressive neurodegeneration that occurs because of that compression. And it can get worse over time, and you can get a lot of symptoms. You can have weakness. And this is degenerative cervical myelopathy. What we know now is that the compression of the cord, this is what we know from animal models, compression of the cord is causing problems in the blood supply. The small vessels within the spinal cord are compromised. And over time, that can lead to some neurodegeneration. So if we're able to capture whether or not the vascular supply in a compressed spinal cord is affected, we might be able to identify which patients are probably going to get this progressive condition and who we might want to monitor and who we might want to treat sooner.
Okay, because there are treatments available right now for this type of condition.
Usually it's surgical, and it's usually not done until the symptoms are more severe. And it doesn't always reverse the symptoms, but it can stop the progression. So ideally, if we identify the higher risk patients sooner, then we could intervene sooner and just stop everything happening at an earlier time point.
You were talking about the artifacts and the noise that kind of makes it difficult to interpret what's happening with some of these images. How were you able to solve for that in this study?
This research, it really isn't glamorous and it isn't fortuitous. We didn't stumble into a discovery. It really is just a lot of hard work and engineering and putting these pieces together in a slightly different way, trying another slightly different way, and it all builds. So I think my graduate student who did this project, I think she had nothing for a while and then nothing and then still nothing. And then by the end of her PhD, it just took off because finally we had gotten the pieces in the right order. Some of the things we had to do involve how we acquire the data. The scanner needs to be very carefully set up to image the spinal cord. We try to avoid getting any artifacts from the things around it. There are tricks we can play. It requires a lot of extra data processing. So how do we record physiological signals about the cardiac pulsations, the breathing, and how can we model that and get rid of it? Because that's not what we're interested in. We're interested in that dilation effect. So there's a lot of post-processing and signal modeling that happens. And then ultimately, what we also saw is if you want to make a really nice picture in one person, you just need a lot of data. So we scanned some of these healthy individuals many times. We scanned them for 2.5 hours with breaks, of course, lots of breaks. But that's a direction that the field is going in for research. It's precision imaging, where you get a lot of data in one person. Now, it's very successful. It helps us be really sensitive and really see an individual person's anatomy and function, but it's obviously not ready for clinical prime time. You're not going to scan a patient for 3 hours in order to get this, but this is how it all starts. I think with every advance with medical imaging, it starts off a little slow, a little blurry, a little noisy, and then things do just keep improving, particularly in this age of AI, machine learning. Radiology is just a ripe target for that. Once you get this kind of first study where you demonstrate we can see something and we can understand it, then it's almost inevitable that it will get faster and better over time. So the hope is that we can get that single subject mapping to really help specific individual patients, but it's not going to happen tomorrow.
Did you use machine learning or AI at all in this study?
Not yet, no. I'm going to have to find a very knowledgeable collaborator here at Feinberg who can help us boost that, but no, we haven't started that yet. This is all without any of those bells and whistles.
The goal, as you said, is translational medicine. So how are you pursuing the next steps after this study?
Right now, we're trying to get the first precision maps in patients because we need to make sure that we are sufficiently sensitive. If you have a compressed spinal cord, can we see the the changes in the vascular physiology there. So that's the immediate step now. I don't want to lose sight of this dual nature of functional MRI, the fact that right now we're talking about it as a vascular tool, but I can also capture neural activity with this imaging as well. So I think another goal is to bring that side back in so that for a lot of these patients, maybe there's this vascular driving factor involved, but fundamentally their symptoms are neurological. So being able to monitor both neural and vascular function, I think will be important long term if this is going to be some sort of monitoring strategy.
So you're sitting between two schools, the School of Engineering and the School of Medicine at Northwestern, and this is a really exciting intersection. There's so much happening right now. What's that like for you to go between these two schools and combine your expertise and use the resources of both to do this kind of research?
I think this research doesn't happen without that interface and blurring that boundary. So all of my students are in biomedical engineering, and we all sit down here in the med school surrounded by people more attuned to the application. And so far, I have found that very fruitful. I suppose also personally, I have never had formal training in neuroscience or anatomy or any clinical experience myself. If I were to just develop imaging methods in isolation, I feel like there's some metaphor about hammers and nails and screws and whatnot that it's probably not a great idea to develop these techniques without really understanding what the goal of them would be. So I don't have to guess at that because I am surrounded by people who have questions and who know what physiological factors are important or what would actually influence treatment or decision making. And so I have all of these reference points that kind of keep me going in a direction where at the end of the day, if what I'm trying to do works, we already know that it's going to be helpful.
It's not just spinal cord injuries and diseases that you're interested in. Tell me about some of the other diseases that you are working on and that you're using imaging to find some more discoveries.
I'll talk about two areas that have been particularly fruitful lately. Both are in collaboration with people who have more of a physical therapy slant and rehabilitation emphasis. One direction is we're trying this precision imaging approach in chronic stroke. A lot of my collaborators here in the Department of Physical Therapy and Human Movement Science have been working with many different modalities, with robotics, with EEG, with pharmacological modulations, trying to understand why some people have the motor impairments that they do following stroke. And there are certain patterns that come out, and they've, over the years, developed hypotheses about which motor systems become upregulated and cause some of these patterns that we observe. The thing is, a lot of these motor pathways involve very deep brain structures, such as the brain stem. And so really functional MRI would be the way to understand if that really is what's happening and what that might mean for rehabilitation for these patients. So I've been trying to take a lot of the precision imaging methods and bring that into this sort of chronic stroke environment to say, in that person, are they using this part of the cortex, this part of the brainstem, this part of the cerebellum? And we can do that now. That involves a lot of engineering. So we build a lot of things that go in the scanner. Our experiments are not simple. They're a bit complicated, but they're also really fun. The other direction that we've been focusing on is multiple sclerosis. So this is in collaboration with Milap Sandhu at the Shirley Ryan Ability Lab. And there we've just finished a really exciting clinical trial where we've been giving this hypoxia intervention called acute intermittent hypoxia to improve motor function in people with MS. So this therapy involves breathing gases, a little bit like what I was doing with breath holding and things. And you kind of alternate between low oxygen and normal air back and forth every minute or so for about half an hour. And it creates this window where function is improved and the potential for neuroplasticity is enhanced. So we tried this out for the first time in multiple sclerosis with this clinical trial. Previously, it had been used in spinal cord injury for the most part. And in this trial, we did see proof of concept that we can improve function with this therapy. And the really exciting thing is we brought in neuroimaging. All of these participants in the trial did a lower limb motor task during functional MRI, and we identified that there are changes in how some of the deep brain structures are activated during this movement. There are some changes in that because of this therapy. And so now we're trying to pursue how to use that information to maybe select which patients are most suited for this therapy or to personalize it so they get the right dose, that kind of thing.
This is very exciting. This really is, as you said, laying the groundwork for personalized medicine using fMRI technology. And you're opening new doors, potentially for your colleagues and peers. What's that like to be the first to really find something, discover it, and publish it?
It's very exciting. It's very fun. But I think when doing this work, you have to be a skeptic. And when you are the very first to see something, it certainly for me, it made me question everything. And my poor student had to really go back and convince me of each interim step and all of the conclusions. And we did so many sanity checks. And we really had to convince ourselves more than anyone else before I really had the confidence to put it out there, because it was new. And that is exciting, but it comes with great responsibility in making sure you're putting out new information that is meaningful long term.
It sounds like things are moving really fast right now. There's these new methods, better technology, there's AI that you're talking about possibly using in the future. Where would you like to see your research go in the next decade?
It's an excellent question. I think there's still this huge barrier to getting the methods we are doing just across the road into the hospital. I see in my mind very clearly the next 10 years of doing research at our imaging center and how I will advance that. That's all within reach. It has so much support. There's so much exciting work we do there. But I do think that the next 10 years is probably a good horizon to be trying for real translation, where we do finally get out of the basement research facility and into the hospital radiology suite. That's certainly happening for all of my colleagues doing advanced methods, imaging other parts of the body. But there's something about studying the central nervous system that it is just a little more difficult, in particular because we're asking people to do things while they're in the scanner. We're asking them to do a task, hold their breath, move their limbs, something like that. And so all of that, it's just that much harder, I think, to translate it into the real hospital system. So it's something that I'd like to really push ahead with over the next decade. The work we're doing now, I'd say it's pretty much 50-50 of how much we're using this method to look at the vasculature and how much we're using it to look at neural activity. And my goal is to increasingly integrate the two in stroke, in multiple sclerosis, in this degenerative cervical myelopathy. Pretty much across the board, you're going to see both systems are implicated. And so I think that's another direction that I really want to pursue. It's making sure that when we are capturing the physiology of one specific patient, that we are sensitive to both of those systems. And right now, I feel like a lot of our studies are going after one or the other. And so harmonizing that, it would also be something for the future.
Why is this the type of research that could really only happen at Northwestern?
We have all the expertise in place. We have the imaging center with the expertise in how to specifically capture function of the spinal cord. We have my group's addition to that, which is refining that to look at the vascular function in the cord with that method. We have several people here across the med school who are pushing this precision imaging, and a lot of us talk to each other and try to enhance each other's methods. And so we're really making grounds on that front. And then we have the amazing clinicians who see these patients who really want this information. And so I'm working now to connect that last little element so we can work on translation.
Molly Bright, thank you so much for coming on the show and talking about your breakthrough research. It was very exciting to hear about everything happening in your lab. Thank you for your time today.
Thanks for having me.
Thanks for listening. Please click the bell to receive notifications about our latest episodes and follow us on social media at NU Feinberg Med to stay up to date with our latest research findings.